Hi, I'm Dr. Roadhouse, and I want to introduce our patient, Donna. She's in our fibromyalgia recovery program. So, Donna, why don't you just talk about what your life was like before you came into this? And by the way, you are 4 weeks and 4 days in the program. We've been doing neurological treatments. We've done all the labs, and obviously the labs are none of the labs you've ever seen before, so
Right.
we don't want to do the same labs they did before. Those labs have not all come in yet, so we haven't even got to the other parts of it, but just the neurological treatments and the oxygen. Just talk about where you were before and then how you're feeling so far just in 4 weeks.
Okay. Well, before I was pretty non-functional. I stayed in bed most of the time. I had a lot of pain in my back and neck and just general pain, all over.
Do the pains kind of move around, like one day they'd be in your foot, or maybe for
Yeah.
a couple of days, and then they'd be in different areas? Okay,
Yeah.
all right.
So, yeah, I never knew,
Yeah.
what I was going to feel like, where I was going to feel the pain. It was almost always, though, in my feet.
Okay.
Like, my feet would be on fire, they'd be cold, they'd be burning, pins and needles. I had no energy whatsoever. And just brain fog, I forget things. I have a little bit hard time talking sometimes, and I'll get to stuttering, or I'll forget my words, and I never did that before. So since I've been coming, like my energy level is up a little bit. My back doesn't hurt near as much. You've been doing adjustments on me, and I mean, this is the best my back has felt in
And you've
years.
had adjustments before where you didn't get much improvement, but once we got
right.
to talk about that, and then we got you on the oxygen neurological treatments, then you've been adjusting easy. Has it ever adjusted that easy before?
No.
And they always had a hard time, and it was very
They always
stiff
had a
and,
hard
yeah.
time, and like the last chiropractor I went to, he would force it, and then
That doesn't work good with
I would
fibromyalgia
be in
patients.
so much pain for like 5 days,
So
afterwards.
now when we're, then we've been doing the neurological treatments, and now we can just basically and it goes easy, right? And it's not painful,
Right.
and I'm very gentle anyway, but the difference is that we've been working on the cerebellum with the oxygen and the brain-based activities, and that has helped out tremendously. So now we were talking a little bit, because a lot of the fibromyalgia patients, they also have peripheral neuropathy, which is your brain perceives, and that's what you have. That's what you were describing.
Exactly.
Is that any better yet?
It is better.
Okay.
It has its days,
Sure.
though.
I mean, it's only been 4 weeks, but nothing else has worked, right? Nothing else has helped. with
Right,
the feet,
exactly.
Okay. All right. So if you could just sum up quickly, I mean, because obviously you're smiling, and you're, compared to when you first came in, and your sleeping is better.
My
your
sleeping
energy
is better. My energy is getting better. I'm still, pretty tired, but I can feel, I know I feel better than I did. I sleep a lot better. My thinking is getting a little clearer.
Yeah.
I can tell. Of course, just the overall pain has already decreased.
Yeah. And that's
quite
just
a
a mark.
bit. Yeah.
Okay, well, thanks. Well, we just wanted to, because a lot of times patients come out, and I'll tell them, I go, look, you're a candidate, you have all the markers, parameters. You remember we talked about that, and I asked you for a commitment level, and you gave it to me. But also, I said you're going to see results within 30 days, and this is the results in 30 days. I mean, compared to what you've had, I mean, no one has even been any close to getting this kind of results,
and I've
right?
seen different doctors for the past probably 6 years.
Yeah, see, and that's just 1 month. So anyway, we're going to check back with you probably after about 2 or 3 months when we get the labs back and get you, on the the diet, and then on all the product stuff, and then we'll see how you're doing. But right now, you can see, hey, I'm on my way now. It's not if I'm going to get better, it's when, right?
Right.
Okay.
Exactly.